Hey everyone, welcome to the video version of the Reviving Vet Med podcast. Today we're talking about psychological safety in veterinary medicine and what it really means when someone says, "My work is not a safe place." I'm honored to welcome Dr. Jolanda Jansen to the podcast. Jolanda is a communications advisor, inspirational speaker, skills trainer, and co-owner of St. Anna Advies in the Netherlands. She specializes in what she calls human skills in animal health, grounded in her belief that understanding human behavior is essential to protecting animal health. She's the author of several books, including Communication in Practice and Tales of Terror, and she recently received the prestigious Anne Wienbaas Penning, a national Dutch award for her outstanding contribution to animal health and welfare. In this episode, we discuss Jolanda's 2025 study, My Workplace is Not a Safe Place: Transgressive Behavior and Workplace Harassment in Veterinary Clinics in the Netherlands. The findings are sobering. Nearly 70% of veterinary professionals surveyed reported experiencing aggression, bullying, discrimination, or sexual harassment in just 1 year. Jolanda and I explore what these numbers mean, why younger professionals and support staff are particularly vulnerable, the role that clients and colleagues both play, and what practical steps clinics can take to create safer, healthier workplaces. We also talk about communication, leadership responsibility, and how we begin shifting from awareness to action. This is a really important conversation, and I'm so grateful to be sharing it with you. So let's get into my chat with Dr. Jolanda Jansen. Hi, Jolanda. Thank you so much for being on the podcast. It's great to have you today.
Thank you so much for inviting me.
Yeah, we're going to go ahead and get right into it. I want to talk about your 2025 paper. So, this was a recently published paper that you titled, My Workplace is Not a Safe Place: Transgressive Behavior and Workplace Harassment in Veterinary Clinics in the Netherlands. This is such a powerful and confronting title. I think even before readers get into the data, that phrase alone is going to incite a lot of emotions. It might even feel jarring to folks. You talk in the study about the fact that nearly 70% of veterinary professionals reported experiencing at least one form of transgressive behavior within a single year, and that included aggression, bullying, discrimination, or sexual harassment. I'm wondering, when you first saw these results come together, what was your reaction, both as a researcher and, of course, as someone who is deeply invested in the well-being within the veterinary profession?
Yeah, well, first of all, I think we were so shocked, right? We knew that these topics were kind of emerging topics, I think, in many professions. So we had them in the media. They talked about the lawyers and the teachers and the human healthcare professionals, and we really were kind of curious. Okay, how is this in veterinary healthcare? And also during our trainings, more and more requests came about, okay, how can we deal with aggressive clients, or how can we deal with money issues in veterinary clinics? So we thought, is there actually any research being done on this topic? So then, well, the answer was no. So, okay, let's do this. But we didn't expect this to be this high. So it means that almost, 3 out of 4 people working in a veterinary clinic actually have experienced this. So it was really, we were kind of shocked of the severity of this and how much it was not a topic to discuss, well, to share, or there was so much taboo on it. So yeah, it's just kind of, yeah, I don't know, maybe kind of normal or accepted that this happens in veterinary clinics, and we were so shocked about, yeah, the extent of this. Yeah.
Yeah, it's so interesting when you put a number to it, right? Because I think we've all had bad experiences in the workplace. Vet medicine is no exception to that. And when I look at these descriptions of workplace transgressions, I have definitely experienced some of those things, not all of them, thankfully. But to think about that in the course of a year, just 1 year, I think about the course of my career over 20 years having very sporadic experiences. But when you look at within the last year, and like you said, 3 of 4 veterinary professionals experiencing that, it really puts it into perspective. And like you said, we have this normalization that, well, that's just vet medicine. There's going to be challenging clients. There's going to be, squabbles with team members. It has, I think, become normalized. And of course, what we want to do is bring attention to this so that we can change that perception of it. You use a very broad and inclusive definition, encompassing aggression, bullying, discrimination, and sexual harassment. Why was it important for you to define it this way within the research study?
Yeah, it was more or less because we looked at other research in other professions, so we really wanted to compare it like that. So on these four, say, categories, we have data on a national level and we have data on human healthcare professionals. So we thought, okay, if we use the same themes and the same definitions, then at least we have something to compare. And of course, if you look at it from a researcher point of view, there is overlap. There can be a very aggressive clients who can also say something about your appearance or about your gender or about. So then maybe one case could tick multiple boxes there. But I think this was just kind of we just wanted to do a pilot and we didn't know about the extent of the information that came out of it, all the examples, all the stress and the trauma that the participants shared with us. And we were so surprised. And then of course in the same time it was like, but we need to do even more research. We should have asked not only have you experienced this in 1 year, but we should have asked how often have you experienced this, and what was the effect of this, and what were the consequences um, for the team or for yourself, and what next steps did you take. And so we had these research results and we were like, oh, now we have maybe answered one question, but now we have 30 more questions we need to answer because of this. So yeah, I think we are in the start of really taking this topic serious in the veterinary medicine, at least in our country. And I think much more research is needed to further understand these numbers, these themes, these topics. Maybe there are many more ways people feel unsafe in their workplace that we haven't even asked. So this is just a scratch on of the surface, I feel. Yeah.
Mhm. Yeah, absolutely. Isn't that the truth, right? And I guess that's the beauty of pilot research is you start with one goal in mind and that it uncovers all of these other things that you hadn't even anticipated. And so clearly there's much more work to be done. I want to springboard actually off of something that you just said, which is wondering with this just maybe scratching the surface, and are there other ways that individuals feel unsafe in the workplace? You have to wonder if people don't talk about their experiences, or maybe don't even report them to their leadership in practice because they don't feel safe to do so. Where do you think psychological safety comes into play in veterinary clinics and in the ways that people respond in the face of some sort of workplace transgression?
Yeah, I think there are two elements to this. So one is um, we didn't ask about how unsafe does this make you feel, right? So a client can become very angry or maybe even aggressive, but that doesn't mean that everyone will perceive that as an unsafe situation. So I think there is always this discussion about what is unsafe or not. The same with, say, sexual harassment or with discrimination. And some say, oh, I like this say male attention, and the other ones say, oh, for me that's already a boundary being crossed. So I think that is one element. The other element is, do we talk about this in clinics about what we feel is appropriate or not appropriate, what we feel makes us, what happens makes us feel unsafe or not unsafe. And of course, there's a difference between persons and between your previous experiences and between your own personal situations. But I think at least in many clinics we've been to, and also what we see in the reports and all the comments based on this survey or in this survey, a lot of participants really shared that, I can't complain. They feel like it's complaining about this towards their management or towards their colleagues. And I can't complain because we all have to deal with this. It's kind of normal in our clinic. So if I start complaining about this, I risk losing my job. Or I risk accepting the fact that this is my job and I don't want to be confronted with this myself, knowing that I'm in an unsafe job. So, because I really love this job. But so I think this is really an issue. I think in many clinics that we have accepted that this is part of the job, but it's not because we don't talk about it. But it's in many clinics, it's really, yeah, kind of if you can't stand the heat, stay out of the kitchen idea. And that makes it very difficult to talk about it if you are suffering for whatever form of this, say, in civil behavior you encounter. So, and the fact that in the past maybe people didn't talk about it doesn't mean that in the past this didn't happen. And I think that's a big issue that we see in many clinics. Like in the past, this was not an issue in the past. Of course, it was an issue in the past, but nobody talks about it. So, and now we're starting to open up these discussions, and now suddenly we see the severity of this in clinics. And I think that's something we all, yeah, need to acknowledge.
You bring up so many great points, and I feel like the mental health advocate in me has to, I can't help but see the analogy between this and mental health conversations. There's a pathology or normalization of pathology in veterinary medicine, in that we're all just going to experience burnout. Burnout is inevitable. Everybody struggles in vet med. Vet med is stressful. That's just the way it is. And you got to just pull up your bootstraps and keep on keeping on. And I feel like this is being lumped into that category whereby we're having these experiences. And for sure, we had these experiences years ago. There has been, I think, a little bit of a shift in society, and society in general becoming a little more uncivil or, rude over the last several years. And we've got research to prove that. But there's always been elements of inappropriate behavior within the workplace, whether it's a veterinarian that yells at a team member or a surgeon that, throws an instrument across the room or whatever it is. That's been around forever. And I think what you said is really accurate, and that we've always just normalized it. This is a part of working in veterinary practice. And therefore, when you do speak up, you risk going against the culture of what has always been acceptable, or really having to do the uncomfortable work of addressing those behaviors. And it is challenging because everybody is different. Like you said, we all have different boundaries. We all have different perceptions of what is okay and what is not okay. A lot of that stems from our previous experiences and our trauma, right? If we've experienced trauma in whatever that might be, a previous relationship or our childhood or what have you, that is going to shape our reactions to some of these behaviors in the workplace as well. So it's very nuanced, it's very complex, it's very layered, and I'm so glad that we're opening up the conversation to talk about this more.
Yeah, and I think also to add is that this was also the first time that we investigated also what we call, say, veterinary professionals in a broad sense. So also the nurses and technicians and receptionists and other people working in a veterinary clinic. And I think that is really an underestimated and undervalued group also. So more research is being done on mental health issues and stress factors for veterinarians, but not necessarily for this, say, support staff group together. And those results were even more shocking that even they really experience even more of this. They are really in the front line. They are this in this first line of defense, maybe also, or meaning also that veterinarians sometimes don't even know what is happening there at the front desk because they get the polite client and they get, the nice conversation, but they didn't know what happened before that. So I think that's also an eye opener of this research that as a team, you struggle with what much more than just you as an individual Maybe
Yeah, I
there's
think
an
that can't be overstated. And having grown up in vet medicine, I have done all the jobs in the hospital from the custodial work to the, client callbacks, working at the front desk, et cetera. And I always say to folks, I think the hardest job in the hospital is the client facing job that our reception or client care team does. And I love that you included all members of the team in this research. And that brings me to one of the questions I wanted to ask you, which is that some of your findings did reveal, as you said, that veterinary support staff reported more aggression than veterinarians. And I'm wondering, from your perspective, what structural or cultural factors do you think might have contributed to this? And of course, the biggest question, too, to follow up on that is what can we do to support our front desk team members and our nursing team?
Yeah, I think, oh, there's so many factors, there's so many reasons. Of course, they are the first contact. So they're also the first who kind of have to disappoint clients. So if I have to wait long for an appointment, or I have to pay, and I have to pay much more than was anticipated. So of course they have more contact in general, and often maybe also disappoint more often. So I deal with emotions more often. The other thing is why would it be easier to be aggressive to, say, a receptionist compared to a veterinarian? And of course, there is this, I don't know if this hierarchy or power balance where as a client, I do not really depend on the service of a receptionist, but I can be nasty to her or him. But if I'm being very nasty to the veterinarian, of course, they still need to take care of my animals. So there is more, I think, dependency in that relation with the veterinarian than there is with a receptionist. Also meaning that as a receptionist, you also don't have the power to dismiss a client, where maybe the veterinarian or the owner of a clinic, specifically in small clinics, of course, they do have that power to dismiss a client. So I think there also, of course, that creates already a difference in hierarchy in teams. What we also see is the way clients are being taught how to behave in a clinic. Um, so in many clinics, you can be very aggressive to a receptionist, but it will never have consequences. While if you would be aggressive to the veterinarian, then it would have consequences. You are not being a client anymore, or you will be dismissed as a client. And that is really frustrating for many, I think, front desk staff or in general, many support staff that, there is never a consequence for bad behavior. And that gives such a, if you talk about unsafety, such an unsafe feeling. So the client always gets away with it because it's our client. We don't want to lose this client. The client pays for our service. So we have to just accept whatever this client does. And I'm thinking, no, there really is a limit there. You have to be able to trust your colleagues, to trust your supervisors, to trust your practice managers or the practice owners to protect you from these bad clients in this case, but also bad colleagues. And that you can trust that there is always a consequence for those when they behave bad. And that's a problem. Often there is no consequence. So you also stop reporting, I think. So once I reported an angry client, and then it was like, no, this was just emotions, and we can accept this, and he paid the bill, and yeah, and the next time, will you then report it? And the next time, and the next time, if there is never a consequence. So um, at least never a consequence for the client. Maybe there is a consequence for you, like saying, "Hey, are you suitable for this job as a receptionist?" Because you complain all the time about these clients. So I think that is really sad if that we don't see that as a factor in clinics.
Absolutely. I think you raise a very important point, which is that this accountability piece is so important, right? Everybody has to be accountable for their behaviors, and there have to be consequences for inappropriate behaviors in the workplace. And as somebody who does a lot of leadership training and communication training, that is absolutely where it breaks down, right? Where you have a team member that speaks up and then nothing happens. And not only does it feel unsafe, and not only does that person who reported it feel undervalued and underappreciated, but it also creates this element of toxicity in the workplace where it's now interpreted that this behavior is okay, that anybody can just treat anybody however they want, and that there won't be consequences for that. And then that just can spiral out of control. You bring up this important piece with the clients, and I know that one of the most striking findings that I found in your research was that clients were the primary source of aggression and bullying in general, overall aggression and bullying, but discrimination was more internal. So
Yeah.
there's these differences, and I'm wondering what your interpretation of that was. Why is there this difference between external clients and internal team? And what does that tell us about where we need to intervene or where leaders need to do better?
Yeah, I think it's, well, in general, we have to state that at least in the Netherlands, in our little small country, um, our our workplaces are not so diverse. So when you talk about discrimination, it's often discrimination based on gender. And then specifically also, so what the participants reported was more discrimination on, say, career perspective. So pregnancy or disease-related discrimination. And that is something I think from a client perspective, you don't really have a choice of who's treating your animal or not. There was a little bit of discrimination, for example, within the livestock profession, that some farmers would say, I want a real man to help me with my calf. You are just a woman and you can't do this. You're not strong enough. But in general, I think if we specifically look at companion animal practices, I think at this moment 80% is now also is female, of veterinarians and of support staff even more probably. So we kind of have a feminine workplace. So most discrimination was more not from clients to veterinary professionals, but more within the team. And aggression, I think, in general, people want to be in a team, want to be nice. If people really start to be very aggressive or bullying, then maybe that's easier noticed than just the client and the individual staff member. So I don't really have a full explanation for that difference, but I think these are could be one of the reasons for this. Yeah, yeah.
Yeah, it makes sense that a lot of the internal differences that individuals might discriminate against, for example, disclosed mental health challenges or disclosed pregnancy or neurodivergence or whatever it might be, those might be then discriminated against internally. And like you said, the more aggression, bullying, etc., that the clients can do that and then they can walk away versus when that happens within the team. Not that it doesn't happen, but when it happens, hopefully there is a little bit more accountability for that, and it doesn't last as long or become tolerated. And again, I think this really highlights the fact that we want, as leaders, those who are listening, who are leaders, we want our team members to be able to come to us and tell us when these things are happening, and we have to do something in response. We can't just chalk it up to a, well, that was just one time and hopefully it won't happen again, or toughen up, and that's just, don't let it bug you so much. Don't be so sensitive. That's something that I'm
Don't be so
often
sensitive.
told.
Yeah, or didn't, when a lot of say leaders within veterinary practice, and so we also had the cases where, say, the practice owner was a white male, 60 plus person with, of course, many years of experience as a vet, and he just said, sexual harassment, it was never an issue. I never have experienced it, but that doesn't mean it doesn't happen to the 25-year-old, very beautiful looking, young, receptionist who is just sitting there at the front desk. So the fact that it doesn't happen to you doesn't mean it doesn't happen in your practice. And I think that is something we really have to acknowledge, that even if they don't talk about it, even if you don't see it, it doesn't mean it's not there. And as a practice leader, you really should be aware of that. Yeah.
Absolutely. And I think it takes a lot of courage to step forward and share something like that that might have happened. And so the last thing that we want to do is question the person who's coming to us. We always want to believe them and reassure them that that's not okay and that we're going to do something about it. At the very least, acknowledging that if that was their experience, it's not okay. Like that shouldn't be what's happening, regardless of whether or not you have a lot of control to, prevent that, from happening again. Maybe this client will never come back. Maybe, you don't have a lot of leverage there, but at least acknowledging and honoring that wasn't okay what they experienced and that you would like to make sure that they do feel safe in their workplace. Um, you mentioned in the research study as well that there was an age difference in some of the experiences. So, veterinary professionals who were in the younger cohort, 21 to 30 years of age, reported significantly more experiences of aggression, bullying, and even sexual harassment compared to the other age groups. I'm wondering why you think those team members are particularly vulnerable. I'm sure that, like you said in your previous example, we don't really know, and it might just be they're these young beautiful looking you know people, or these young people that get a lot of attention, and therefore they can succumb to that. Yeah, I'm curious as to what your thoughts are, and of course how we can better protect and mentor those younger professionals so that they don't take this to just be normal behavior in the workplace.
Yeah, I think in general, when you're just finished, school, and it's just your first years of experience in your profession, then of course you kind of feel insecure about maybe about everything. And that makes you maybe an easy victim, right? So, especially for clients who are high in their emotions or high in their, I don't know, in their um, extrovertness, or maybe more demanding, that it's very difficult to step up to these clients. And I think, as I said before, it's also about these power balances, right? So as a young starting vet or a vet nurse, you don't maybe have the power or the authority um, to say to the client, okay, there is, there is the door, and I'm not going to help you. Well, as a vet or as a practice owner, you may have more authority in that. So I think there is this difference. I think there is also a difference in expectations. So clients have different expectations from younger people maybe than from older people, or have different expectations from the veterinary clinic in general. Um, and then there is this issue of communication, where when it's about expectations, we often are also not trained in how we communicate those expectations. So, a good example is that, the vet says in the morning, as soon as I have the lab results, I call you right away. I call you as soon as possible. And then the client is just waiting for the phone call. And then the client calls, I don't know, before lunchtime. And then the receptionist says, well, the results are not there yet. The vet will call you as soon as possible. And then the client calls at the end of the day. Well, the vet didn't. And then the vet at the end of the day at 10 o'clock had emergency shift, had all these issues and things. Well, 10 o'clock at night, I can't call the client anymore. Well, let's do it tomorrow morning. Tomorrow morning was very busy. So again, tomorrow morning, the client calls and thinks, where are these lab results? And then, of course, the client becomes kind of angry. And there are these expectations that have not been met. And then again, the question is who is in front line there? Who is the first person to contact? It's not the vet who forgot to call. It's often the receptionist or maybe a younger vet or who has to bring that bad news to the client that there is still no answer. And I think that makes it frustrating that you're dependent on your team members to keep your promise towards the clients. And I think that's where a lot of things go wrong as well. And that is something we can do ourselves. So sometimes we do make it ourselves very difficult to set expectations that we know beforehand we cannot met. Um, and then beforehand, you can already expect the client to become angry. So I think there is much we can do also in that aspect to set good expectations for clients.
Yeah, the communication is so important, and yeah, anger so often stems from unmet expectations or disappointment, frustration, whatever it is, and then as you said, it's often the front desk team that has it taken out on them. And then when we are younger and less experienced, or we feel more insecure, or we just haven't equipped ourselves with those skills yet, we don't know how to respond. We don't know what to say. We don't feel confident to set a boundary, or because of those power differentials, we truly don't believe that we can set a boundary. I know that you have a lot of training, background training, and interest in communication, and you have developed tools like the veterinary dialogue trainer. You mentioned these communication skills. How do you see those intersecting with preventing or de-escalating these transgressive behaviors in practice?
Yeah, I think it's of course, you deal with emotions. It's part of your job, right? You often when clients come in, they're not necessarily happy. It's always because there is an animal that is in need. So there are always emotions, and we have to anticipate on that. And it really is such a difference whether people are upset of the situation or whether they are upset about you. So you have to understand that dealing with these emotions is part of your job, and you can train yourself on that. And then, so for example, if I call to a clinic and I say, okay, my dog has an ear infection and I need antibiotics now, if my first response is, I can't give you antibiotics because that is the protocol, and we need to see him first, and we need to check him up first, and then we can give you the medicines. Then, as a client, of course, I get upset. Why protocol? I have a sick animal here. I have an animal in need. I want to have a solution and I want to have it right away. Yes, but we can't because it's protocol. I don't care about your protocol. So that's how things easily can escalate. Well, if at the other side we make it relevant for them. If we can say, "Oh, I'm so sorry to hear. Thank you for calling. Good that you noticed. We both want the best for Fluffy. Ear infection is a nasty thing, and this is the second time, in 2 years or whatever, he has this ear infection. We both know that if we put medicine into a damaged ear, we're going to worsen things. So you don't want that. We don't want that. So the best for Fluffy is to make an appointment." Then, of course, still a client can be frustrated. I don't want to make an appointment. And then again, you can say, I understand your frustration. I understand, of course, this is not, you know, this is not what you want at this moment in time. It's, of course, never a good time for these things, but we both want the best for Fluffy. So my advice still is, please come in so we can help Fluffy the best way possible. Shall we make an appointment, or I can make a special place for you this afternoon? So then you really get a different approach. And I think at this moment in time, when you talk about communication skills training, we are often not trained. So in many vet schools, this is not part of the curriculum for veterinary professionals. So say the support staff, it's not a part of the curriculum. Yes, you learn how to deliver bad news. Yes, you learn how to take a good anamnesis or do a triage, but you don't learn how to deal with emotions. So what we see in practice is that when a client becomes upset, the first way of defense is, or the first response is the defense. So when the client is at the front desk and needs to pay a very large bill, and the client is at that time saying, wow, that hurts, we immediately starts defending. yes, we really did a lot of work, and yes, our costs have increased, and yes, I don't really get paid that much. And did you know how long we worked for this? And you should have come 3 weeks before, because now the problem really worsened. And so we immediately start defending, but that is not what the client wants to hear. The client just wants to hear, thank you for taking so good care of Fluffy. Fluffy, you are so lucky with this person as your owner. You have this very golden house there. It is good, you have such a good owner who takes such good care of you. That is what you want to hear. You don't want to hear the defense. And I think that is something you can prepare yourself for. The same as the expectation management. Never say, the vet will be there right away. Just say, the vet will call you at the end of I don't know, at Friday afternoon before 9 o'clock in the evening, the vet will call you. Because otherwise you start already disappointing people, because you have set the wrong expectations there. So there's so much more you can do to de-escalate or to prevent these situations from happening. And I think communication there is indeed key. Yeah.
So many great suggestions. It sounds like empathy is that real key piece with clients when you see that they're getting upset or frustrated to recognize, yeah, you've been waiting a long time, or yeah, excuse me, gosh, it was a lot of money that you spent, and how lucky Fluffy is to have you, all of these different things to really connect with their experience rather than making it about you. And I am all about, yeah, I'm having a hard time finding the phrase right now, but there's this notion that, you want to set the bar low in terms of expectations so that when you
And the
exceed those
promise, and the
expectations,
promise over deliver is it.
under promise, over deliver. Yeah. So, the vet will probably call you hopefully before 9 o'clock on Friday. And then if the vet is able to call by noon on Friday, then this is a real win for the team. So, yeah, being very realistic and giving a lot of buffer windows as far as communication goes and other things is really key to prevent the emotions from coming up, because like you said, it's, yeah, we're trained to take a good history and maybe give a good explanation and signpost our different steps within our physical exam and so on. But when emotions get elevated, that is where I think our training is lacking. And so I'm glad that there's the veterinary dialogue trainer and other trainings that are out there for team members to take part in. Um, there was an interesting point, and we alluded to this at the beginning of our conversation, in terms of the study demonstrating that for veterinary professionals in the Netherlands, there was the higher rates of aggression and bullying compared to their counterparts in human healthcare. And I'm wondering what you think is the reason for that difference. What makes vet medicine uniquely vulnerable when it comes to aggression and bullying?
Yeah, I think well, we didn't investigate, so of course this is kind of an educated guess, um, but so when it is about expectations, in veterinary medicine, there is money involved, and in human healthcare, there is not. Or of course, there is money involved, but that is all by your social security and insurance payments. And so at least in our country, you don't really get the bills of your doctor, so you don't know how much a hospital admission costs you or costs your insurance. Luckily, we have those systems here in the Netherlands, but that means that when your dog is administered to the hospital and you get the bills, then suddenly you're very surprised. How much is this for just a dog? So I think there is a difference in what clients expect or know or understand, or what knowledge they have about the cost of veterinary care in general. And of course, that can lead to difficult situations. You really love your dog, you just don't have the money, and there is this veterinarian in between who can cure your dog or can help your dog or your cats or your rabbits, that you got free from, I don't know, someone, or you found it on the street, and now suddenly you have to pay for that. So of course, that is different, I think, compared to human healthcare. The other part is indeed the training, and the training on the emotions. I think now in healthcare there is more training on dealing with disappointment, dealing with difficult situations, um, dealing with what we call contextualized care, so what care is appropriate. And yeah, as I said before, in veterinary education, there is not so much attention to that. So I think again, we sometimes create also the problems ourselves by the way we communicate to clients. And that is, I think, maybe in healthcare already addressed, or maybe not as much as we want to, but at least it's addressed more compared to veterinary healthcare. Yeah.
Yeah, that makes sense. Um, I think this is a great first step in bringing attention to these issues. I'm wondering, since publishing the research, have you seen any shifts in awareness or policy or dialogue in the Netherlands? And if so, does any of that give you hope that meaningful change is possible?
Yes, we are very hopeful. Yes, no, no, it really sparked something in our profession. I think on a European level even. So more and more initiatives are now or have started or are in the process of starting to support mental health and well-being, and not only of vets but also of all the support staff. So at this moment we have an initiative called Purple Heart, where across all, organizations, veterinary organizations in the Netherlands, they have signed a manifesto where they promised they made a promise to improve the health and well-being of veterinary professionals. About more than 30 veterinary organizations have signed that manifesto. So I think that is really a first step in acknowledging that this is an issue that we as a profession, as an industry, we have to acknowledge and cooperate with each other to make change happen. And at the same time, we also now have this safe veterinary hotline where it's kind of a support line. So if you feel you need to talk to someone for whatever reason, could be happy reasons, could be sad reasons, there is this support line where also people with a veterinary background are anonymously listening to you and making it possible to yeah, to give that support and to yeah, and to at least share that you're not alone. So the fact that more and more people are now sharing this, are more open towards what they have experienced in mental health issues, or when it's about the neurodiversity, or when it's about, the things they have done within their clinics to deal with these issues. I think we can really learn from that. So it's really nice to see and more research being done on this topic. So yeah, it really sparked. I think it's a general theme in society, it is, but this really helped also to create those conversations within the veterinary profession. Yeah, so much is happening at this moment. Doesn't I'm not. At least I hope it will also result in better workplace safety, better mental health. So it's always put your money where your mouth is. Eh? There are good intentions, but think we all are responsible for our own behavior in our own clinics, in our own situations. So that's where it starts. Give the good example, talk about it within your clinics. So yeah, I hope it will drive change in one way or another. The first signs are there, but I'm still.
Yeah. Well, those are some beautiful initiatives, and springboarding off of that, if there's a practice owner listening who wants to make sure that they have a safe workplace, what are one or two very practical, tangible things that they could do to protect their team members in situations like these or
Yeah,
from
so first.
situations?
Yeah, no, so first ask. So you can say, okay, there's this research from the Netherlands, this little crazy country, but how is this in our clinic? So have this open conversation with your team members. How is this in our clinic? Then second, I think also what is appropriate behavior? What do we accept as a team or not? And what would be the next steps if you experience this kind of behavior? Could be from colleagues, could be from clients, but what would be your next steps in a safe and in an open way, discussing if you have ever experienced this, or then this is what you should do, and also understand that there are consequences for those. Say for the client who is being, incivil to you, that you know that you are supported, that your team has your back in these kind of situations. And then, of course, the final thing is training. So to prevent those expectations, to have that under promise, over deliver, to make sure you know as a team how to deal with the demanding client who is not yet being aggressive, but he just doesn't get what he wants or she wants. Um, and then how do we deal with that as a clinic? Because if I say to the client, I will not give you antibiotics without, a proper diagnosis, and but then my next colleague is saying, oh, I can give you that. Don't listen to her. I will make an exception for you. Of course, then you create your own problems. And I think that is something, um, make good agreements as a team on what your policies are and how do you respond in an empathetic way to clients who ask you things that you can't deliver. And training, of course, is there and is an important thing that could help you feel more safe in these situations. Oh, so
That's
much
I
fun.
love it. It's wonderful advice, and I want to finish with just one last question that we ask every one of our guests on the podcast. What does the phrase reviving veterinary medicine mean to you?
Oh, it means so much because it means that there is such a beautiful profession with so many opportunities. And I think for me, it means that it's kind of our slogan, if you want to keep animals healthy, there is only one species you need to know most about, and that is the human being. So reviving is also, yes, invest in your veterinary technical skills, but please also invest in your, say, human skills, because you really need, human skills to thrive as a veterinary professional, in all aspects. So, yeah, that's I think more or less what I what I think of him. I think about reviving. It's like, oh, it's so much more we can do. We can be so much more effective if we invest in those skills as well.
Yeah, it's very, very hopeful and positive way to look at it. Well, thank you so much, Yolanda. This has been such an interesting conversation. Your research is so important and clearly is already making an impact on the profession in Europe and I'm sure beyond as well. So I can't thank you enough for taking the time to have this conversation with me.
Thank you so much for your time and for listening, to
Of
to all.
course.
Thank you.
Thank you so much.